What is the problem? Like, almost nothing is wrong with healthcare except the business model. Why is Blockbuster not the thing that we go to for media consumption anymore? It's because the business model doesn't work for the consumer. I am not all that up for driving somewhere, getting out of my car, going into a retail store, getting a movie, paying $5 for it, taking it home, watching it, rewinding it, taking it back. That business model does not work for the modern consumer anymore, and it hasn't for years. The same can be said for the cable companies, the same could be said for healthcare. It no longer works. The very business model of having some procedure and getting billed for every single little thing along the way, and we've all experienced this. You know, you're at home and the mail comes, and the mail comes again, and it comes again, and it's all these bills from your provider, the hospital. You just get these bills that are so unbelievably confusing because you're getting billed for every single thing along the way. You don't know what those things are. You don't know who the providers are, if they're in network, out of network. It just doesn't work. And we see that in the form of employer costs are rising. Medical costs, compete for the top medical spend of any employer in the country. Half of that spend is surgical spend. Half of it. Within that spend, the chaos and craziness is completely out of control. The variance in pricing on the same procedure can be 5x. Why does that make sense in any scenario? Transpose that onto any other industry, it just doesn't make sense. 1 in 4 surgeries is actually unnecessary. Why is it happening? You go to see a surgeon. Do I need surgery? Of course you're going to need surgery, because that's how a surgeon gets paid. So that's where the economics, the business model of healthcare doesn't work. And that's why 1 in 4 surgeries are unnecessary. So in any way that you look at what's happening in healthcare, in employer-sponsored plans, and the patient experience, the financial outcomes, the health outcomes, we should all collectively be very, very ashamed of ourselves. But we have an opportunity to change it. We have an opportunity to usher in a new business model, just like Netflix and HBO Max did on the heels of Blockbuster. We have an opportunity to change it. And that is what Carrum is doing. We are ushering in a new business model, a new business innovation to change the economics, to change the patient experience, to change health and financial outcomes for everyone.